This week, we're talking about choice theory, reality therapy. And this approach focuses on our choices, which is pretty obvious because it's in the title. So, choice theory explains why and how we function. Reality therapy provides essentially a delivery system for helping individuals take more effective control of their lives. This approach consists of helping and sometimes teaching people to make more effective choices in their lives. So, it's all about choices, what choices we're making, and we'll get into that a little bit more. So William Glasser developed this approach, and again, right, it feels almost redundant to say it at this point. He rejected the Freudian approach, and he said, I don't agree with that. I'm going to develop my own approach, something that makes more sense, to me at least. So reality therapy, he went around, it ended up going through several different growth stages as he, went around. So he started to teach it. He originally called it reality psychiatry, and I think people were kind of like, what is this? What is that? We don't understand what you're talking about. So then he had eventually changed it to reality therapy, and it started to gain momentum and, became more popular. And then he learned about control theory from William Powers, and he essentially rolled that into reality therapy and incorporated it into his approach. He continued to expand his approach, and ultimately he ended up calling it choice theory, which is what we know now. Robert Wobolding, if I'm pronouncing that correctly, he attended many intensive trainings conducted by William Glasser, many webinars, or different trainings and stuff like that. It probably wasn't called webinars at the time. And he continued to expand Glasser's approach, and he's written lots of books, lots of articles, etc. So I like this quote that's on the screen here because it highlights that we have the power. We are the ones who are making the choice. And there's no victim, there's no blaming others for our problems, our issues. It's all about us taking that responsibility, and it's up to us to make the changes we want to see and be the person we want to be. This approach believes that we're born with 5 genetically encoded needs that drive our lives, and whenever we feel bad or down, one or more of those needs is essentially going unsatisfied or isn't being met. You can see the needs there on the slide, and they're all pretty straightforward in how you would explain them. The need for survival is like the need to be alive, the need for self-preservation. Love and belonging here is the one that can sometimes be difficult for clients to meet because it includes having relationships with other people, and if those needs aren't being met through those relationships, or if those needs are being met, say, through an unhealthy relationship, that's where those issues and problems can arise. So love and belonging needs, it specifically highlights our needs for others and developing those healthy relationships, which is part of what we as therapists would work on with our clients in terms of, say, goals for therapy. How do we develop this relationship into a healthier relationship? How do we, something that I've focused on quite a bit in therapy, not by necessarily choice specifically, but clients will come in, and one of the big things that I end up working with them on is communication, in terms of improving their communication with their significant other. So coming back to love and belonging in terms of needs not being met. A lot of times clients will say something like, we're just not communicating, or our communication needs to get better. And it turns out that across the board, a lot of times we as humans are not very good with communicating what we're thinking, what we're feeling, what our needs are. And so working with the client in terms of developing better coping strategies, kind of going back to some stuff that we've seen in previous lectures in terms of increasing awareness of emotions. All right, well, when he says that to you, or when she says that to you, how does that make you feel? What does that make you think? Increasing awareness around those things, which you'll see here at the bottom of the slide, is very similar to choice theory, reality therapy, incorporates some of those CBT aspects, and helping the client build out those healthier coping strategies so that when there is conflict in the relationship, or when they're having, say, a disagreement, that they're able to work through that more effectively, as opposed to, having some big fight or some big blow up, and then they don't talk for 3 weeks, and then they come back to, kind of that like teenage, we break up, we get back together, we don't know what we're doing. And so helping clients develop relationships and improving that communication is definitely something I have experienced in terms of working with clients in my own practice. Power, that is, being in control, having control over things. And we'll talk about that a little bit more in a couple slides, but essentially, this approach highlights focusing on what we can control. We'll come back to that in a minute. Freedom, having independence, the ability to make our own choices in line with what we want to do, being able to have fun in life, that type of thing, are the 5 needs. Total behavior, you would have seen this in the CBT lecture. Again, incorporating CBT aspects and emphasizing thinking and acting and how those different aspects there, the 4 distinct components, acting, thinking, feeling, and physiologically what's happening in our body, how those things are impacting decisions, impacting choices, impacting decision making. At this point, you probably have really realized that there's a lot of overlap in the different therapy approaches that we've talked about and the different theories. And so at this point, it's more of getting into the smaller nuances of what specifically sets this therapy approach apart from the others, or what sets apart this theory specifically. Because across the board, right, therapists, we're going to be acting ethically, we're going to be acting empathically, we're going to work on building those relationships with our clients that are healthy relationships so that the client can become better and move towards their goals, etc. So all of that stuff, all of those types of things, in terms of therapeutic relationship, all of that is very consistent with this approach as well, nothing different there. This approach does reject transference, however, again, right? Glasser wasn't super wild about the Freudian approach. And so if a client reacts towards the therapist and claims, I see you as my father, or I see you as my mother, Glasser would say, no, I'm not your father, I'm not your mother, I am me, I'm myself. Don't project anyone else onto me. So that piece of it is slightly different. This approach is similar to Gestalt therapy in that it focuses on keeping therapy in the present, or right now. In the now, as Gestalt would say. So Glasser would say, whatever mistakes were made in the past, it's not pertinent to the present, it's not in the now, so we're not going to focus on it. A past choice may be contributing to a current problem, but again, Glasser would say, the past is never the problem. Let's focus on what the current problem is, what's happening right now. So to effectively help people function, Glasser would say, hey, we're going to be in the present. We're going to take steps to create a better future. So one of the big aspects of this is focusing on, again, what choices are you making, either consciously or unconsciously, that might be impacting thoughts, feelings, behaviors, and vice versa. What types of thoughts, feelings, and behaviors might be impacting your choices, and increasing awareness around those factors and aspects. So reality therapy focuses on what is within our control. And I said that I would talk about this a few slides ago. It really focuses on, Glasser would say, focusing on what is outside of our control is a waste of time, because it's outside of our control. We can't do anything about it. So the focus is on what is the only person that you can control is yourself. And so let's focus in on that, because focusing on anything else isn't really going to add any value to the conversation. Reality therapists spend very little time listening to complaining, blaming, criticizing. They'll refocus the conversation back on you. So for example, if I have a therapy client, what's a good example or an easy example? A client comes in and she complains about her husband. Oh, my husband doesn't take out the trash. The therapist would say, whoa, let's refocus this back on you. If he's not taking out the trash, what are the choices that you have, right? The reality therapist is not going to listen to, oh, I'm going to complain about my husband. They're going to say, what choices do you have in that situation? The therapy client might say something like, well, I can be upset at him. And then the conversation would surround, all right, well, if you're upset at him, is that going to get you anywhere? How is that going to impact things? Is that going to help you get what you want? Which is WDEP, wants, directions, or doing, self-evaluation and planning. And the client would say, no, it's just going to have me be upset at him for a couple hours. I'm going to be irritated. He's going to be irritated. It's not going to really get us anywhere. And so, okay, well, what other choices do you have? Well, I could take out the trash. All right, well, what thoughts, feelings, behaviors, etc. would you be experiencing if you're the one who takes out the trash? Like, well, I would be really irritated. I would be thinking, how annoying is this that I have to take out the trash when I asked my husband 3 times already to take out the trash, and I'm going to do it, but I'm going to be really irritated. It's going to mean that, maybe dinner is a little bit late because I'm trying to get dinner ready, but now I have to pause that to take the trash out, etc., etc. And then, okay, well, what other choices do you have? Well, I could, give him a friendly reminder. I could ask him to take out the trash again. All right, well, what thoughts, behaviors, feelings, physical sensations, etc. are you experiencing? If you're just, ask him, hey, honey, can you please take out the trash? I really need the trash can empty as I'm trying to get dinner ready, etc., etc. And so exploring with the client and helping them kind of cognitively think through, you have this choice, but here are the consequences, or here is what will happen if you engage in that choice. You have this choice. Here are the consequences, or here what could result if you engage in that choice. And helping them essentially explore, are their choices moving them towards what they want? So wants are focused on helping the client explore, what do you want out of life? Helping them define what that looks like. For example, what kind of person do you want to be? What would your family life be like? Or what would your family be like if all of your wants were met? What would you be doing differently if you were living the life that you wanted to live? Direction and doing. So, what are you doing to help you reach your goals or what you want from life? What's stopping you from doing what matters most? What did you actually do today to help you move towards your desires? What will you do tomorrow? Self-evaluation is, how is your current behavior bringing you closer to the people that are important to you, or moving them away from you, or moving you away from them? Is your behavior pushing you further away from your goals, or further closer to your goals, or closer to the people that you care about, or further away from the people that you care about? So incorporating that self-evaluation, if you might notice, is really increasing that self-awareness and getting the client into that practice of that self-evaluation of, wait, let me think about, what is the impact here? How are my behaviors, thoughts, actions, etc. impacting my choices, and then by choices impacting others around me? And then coming up with a plan. So the therapist and client would work towards creating some type of plan, and having the client move towards commitment, towards taking action towards that plan. So think very similar to SMART goals, right? The conversation in therapy might look like, is this plan realistic? Is this attainable? Is this within your limitations? So for example, a client who's struggling with depression, it's probably not realistic to say, all right, you want to go to the gym, let's have you start going to the gym 6 days a week, right? The client will come back next week and say, like, I didn't go to the gym at all. And so again, we want to be setting our clients up for success. So we might start with something really simple, like get to the gym one day this coming week, or just walk around the block a couple times. Again, it's going to depend on the client, where they're at. But starting, knowing what the client's limitations are in terms of their motivations, how motivated they are, in terms of how much they want this, whatever they want out of life, are they actually going to take commitment and make action towards taking steps towards action, or, are they going to end up just kind of falling back in the slump that they've been in, if you will? And then again, this approach might be a little bit more challenging, kind of similar to a previous approach that we saw, in the sense of, if a client isn't engaging in behaviors or choices that are in line with what they want, where they're trying to get to in life, the therapist might, kind of confront them a little bit and say, like, this is what you're saying that you want, but this is your behavior. Help me understand how there's a gap between these two when they should be overlapping. Your behavior should be lining up with what you want to do. I said should there, which we talked about in CBT quite a bit. And so, this tends to be a little bit more confrontational in that sense. And you can do it in a soft way, right? If you're not really the type of person who's confrontational, or if your clients aren't the type of individuals who are in a space to be open to confrontation, you could bring that up in a much more soft way. So for example, I might say something like, okay, help me understand, because I want to work with you, and I know that we've talked about, your wants are XYZ. So on one hand, you're telling me that you want to lose weight, but on the other hand, you're telling me that you really enjoy baking and you love taking baked goods to your work colleagues, but then you end up just, eating anything that's left over, and sometimes that's half the pan of, cake or whatever it is. So help me understand how those behaviors, how that behavior isn't in line with what you want. And then having a conversation with the client and then exploring what choices they have around that. Like, hey, maybe instead of eating, I don't know, half the pan of cake, taking it to, I don't know, somewhere else where you can donate it or give it to someone else aside from work colleagues, or, exploring ways that you can bake, but then give your baked goods to a homeless shelter, or, etc. So helping the client explore what their choices are, and bringing that confrontation into the space in a way that is supportive of the client, and not in a way that's like, oh, so you told me that you want to lose weight, but you keep baking. How's that going for you? Right? Because that's probably not going to be supportive of the client, and that's probably not going to be helpful. Again, depending on who the client is, right? Sometimes clients want you to kind of be confrontational like that, and like, oh, yep, I need that. I needed you to just kind of like call me out there. But again, part of that is going to be getting to know who your clients are and working with them. So here's the exercise for you guys for this week. One of the discussion questions that you can choose to do for this week's discussion post. The research article that I wanted to cover this week is Psychoeducation Group Intervention Based on Reality Therapy to Cope with Academic Procrastination. Just because procrastination, I know sometimes that tends to occur in students. Not that I've ever experienced that at all. So the participants were 36 university students. This research was actually conducted in Turkey, so there's some diversity aspect to this research as well. The procedure was they did 10 weeks of coping with they did like this 10-week training program, which was focused on academic procrastination. And if you pull up this research article, interestingly, on page 227 of the article, there's actually an outline of each session, which is really nice because sometimes research articles don't really go into depth in terms of like what type of training they did or what their actual training looked like. So it's nice that they provided that outline there. In terms of data, they looked at pre and post, and they also did a follow-up at 1 and 3 months, and that's when they gave individuals the measurements that they used. They looked at the academic procrastination scale. There weren't any inclusion-exclusion criteria that I came across in the article. Limitations were, longer follow-ups, so maybe it would have been better if they could have incorporated or done like 6-month follow-up, 12-month follow-up. There was a low sample size, 36 people isn't very much. And it might have been beneficial to explore and use other academic scales or other scales in general. So for example, looking at how does procrastination impact anxiety or depression? So using an anxiety scale or using a depression scale might have been beneficial. Or exploring other things, such as if they had given a strengths questionnaire or assessment and looking at how does procrastination, is there any tie to strength, and if someone uses their strengths, does that help them procrastinate less, like that type of thing. So future research could be beneficial in terms of looking at different academic levels, so not just looking at university students, but also looking at, say, middle school students or primary students, and then also incorporating some of those different questionnaires that we just looked at, as well as finding a bigger population or incorporating more people into the study, not just 36. And then the results showed that the program was helpful. So if you complete some type of program that focuses, or this program specifically, because this is what the research was on, that focuses on incorporating, more working on procrastination, it can be helpful. Implications, one of the important things to think about is if I worked at a clinic setting, in a college counseling setting, or if I worked in a clinic setting where I was seeing academic individuals, where I was seeing students, any type of college setting essentially where I might result in, seeing individuals who are at risk of procrastinating, academic procrastination specifically, I might want to consider using this therapy approach, and I might even want to consider using this 10-week program because it looks like the results were really helpful in terms of the program being useful to decreasing individuals' academic procrastination. So, some really cool research there. Lastly, I wanted to throw in one more quote because I like this quote. Life is a matter of choices, and every choice you make makes you. And I really think that that's true, right? The more that you go to the gym, the more you see yourself as someone who is athletic and like, yeah, I'm someone who goes to the gym. Or the more that you go for a run, the more you're like, oh yeah, I'm a runner. And so I think it's a cool idea to kind of play with what are the choices that you're making that are making who you are. Here is the discussion question options for this week, and here are my references. You guys have a good week.